What is necrosis? Necrosis is a premature cell death. Necrosis is a series of morphological changes in a permanent and lethally injured cell. There are two pathways of cell death. The first pathway is necrosis. Necrosis is always pathological process. And the second pathway is apoptosis. This can be pathological or physiological. However, these two pathways are different altogether. The causes of necrosis to living cells is due to a bacterial inflammation releasing toxins and damaging the cellular membranes. Necrosis always occurs due to the irreversible or unwanted cell injury. It's known that external factors play a role in the process of cell death. The cell swelling can eventually cause cell death.
Type of necrosis and their causes. So first type of necrosis is coagulative necrosis. This happens due to the release of hydrolytic enzyme into the cellular matrix that digests cellular components. This can be caused by vascular occlusion, hypoxia, and different type of toxic chemicals. The other type of necrosis is liquefactive necrosis. This can be seen in brain tissue. It goes due to the bacterial and fungal infection and by the condition of hypoxia. The other type of necrosis is cascadic necrosis. This can be seen in the tuberculosis. In this type of necrosis, necrotic debris do not get completely digested by the enzymes and can collect it into the place. Fungal infection can be the cause of this type of necrosis. Other type of necrosis is fat necrosis. This type of necrosis occurs due to the action of lipase on triglycerides, and triglycerides break down into fatty acid that combine with calcium and magnesium ions, which can lead to soap formation. And the causes are action of lipase, enzymatic and traumatic injuries. Other type of necrosis is fibrinoid necrosis. This can be seen in various arteries, veins, and capillaries. And immune-mediated vascular damage can be the reason for this type of necrosis. And connective tissue disorders and mediated hypertension are also the causes. And last, this is gangrenous necrosis. This can be the result of hypoxia condition. The causes are infection and injury, environmental stress like frostbite, and a long-term condition for blood circulations like diabetes and atherosclerosis.
Hi, I'm Jesse, and I'm going to talk about pathogenesis of necrosis. Previously, necrosis was thought as an unregulated cell death, unlike apoptosis, which is programmed cell death. But now recent evidence shows that necrosis is actually genetically regulated by effector compounds such as tumor necrosis factor A, and also inflammatory cytokine called kinase receptor interacting protein, RIP1. This leads to eventual loss of cell membrane integrity and uninhibited cell lysis, and the release of necrotic cells, which causes an inflammatory response. This inflammatory response averts phagocytosis, and this creates cell death. All necrosis shows cell blebbing of membranes, cytoplasm swelling, and the disintegration of organelles. This is followed by the opening of mitochondrial membrane pores, which results in a loss of membrane potential. This also results in the intracellular acidification caused by proteolysis activation of capain and capsin proteases, and this culminates in cell lysis. As discussed earlier, this cell lysis creates necrotic cells into the extracellular space, which creates the cell death of necrosis.
So, the abrupt onset of ATP depletion leads to hypoxia, ischemia, mitochondrial damage, and also actions of some toxin. The activity of the sodium pump reduces, so therefore The sodium, calcium ions and water also reduces. However, there is an efflux of potassium ions. Also, this is accompanied with isoosmotic gain of water, causing the cell to swell. Also, ATP depletion leads to anaerobic glycolysis, which accumulates lactic acid, and the pH in the cell decreases. Therefore, the enzymatic activity also decreases. In mammalian necrosis, there are two general pathways with both cellular and nuclear changes. The first of the pathways initially compromises with a gain of cell volume by oncosis, which is followed by karyolysis, and after pycnosis, which is the nuclear shrinks. And the second pathway typically has a process called karyohexis.
Presenting today on diagnosis of necrosis. Diagnosis of necrosis or radiography is the most convenient diagnostic method for necrosis. It is used as a first-line diagnostic test and is inexpensive. Figure 1 shows as a necrosis caused by tear tendon. Radiation therapy performs an important, significant role in diagnosing necrosis in the human bones and brain. A radiograph demonstrates an extent in the recurrence of the disease in the body tissue. X-ray examination provides any changes that may occur in the stages of necrosis. Figure 2 shows healthy bone X-ray and affected bone tissue. The figure left shows as a healthy formal head, and the right picture shows as an X-ray film of the osteonecrosis formal head. Tissue scanning scintigraphy is important, playing an important role. Is examine and extend diagnosis in early stages. Bright spots appear on the imaging plot which detect the affected areas. Figure 3 shows the bone scanning for the extended of necrosis and humeral head. Titanium and many plaques are used in radioactive materials. These materials are biocompatible and are corrosive-resistant materials. MRI and CT scan provides early detectable changes in the organ affected. They allows the quantification of the affected tissue and the extent of region damaged. The figure shows CT scan of vascular necrosis caused by cell leukemia.
Treatment of necrosis. In order to effectively treat necrosis, the underlying cause must be first dealt with in order to prevent further damage and for dead tissues to be taken care of. Antioxidant treatments are used to combat reactive oxygen species that can damage DNA and proteins. Chemical or toxic agents are identified and exposure is prevented to avoid further damage. Antibiotics and anti-inflammatory drugs are used to prevent infection and necrosis. Dead tissue is dealt with through debridement to promote healing of healthy tissue, and it involves the removal of infected skin to amputation of limbs depending on the severity of necrosis. Autolytic debridement involves the autolysis of cells through the body's own natural processes for repairing damaged tissue. Larval or maggot therapy is when sterile larvae, the Cilia sericata, are introduced into the wound, where they secrete proteolytic enzymes which break down necrotic tissue for consumption. Mechanical debridement involves physically removing necrotic tissue and debris. The method isn't widely used due to the pain caused to the patient. Surgical debridement is performed in an operating theater, but it's quite expensive due to the necessity of the